We wait for a few minutes more. We are already live on the YouTube, but we wait for a few people to join again. Then we'll start.
Good morning, Hemant.
Good morning.
Good morning.
Good morning. Good morning, madam. Harak.
Sir, KGP માં કોણ છે dietitian?
We don't have a dietitian as such.
Okay.
We had earlier, but then very few cases were being referred to her. Most of the pediatricians advised diet and everything.
Yeah, exactly. we do it
So,
ourselves.
that's right, because most of the advice in Well Baby clinics also is regarding diet
Right.
to the child.
Right.
Mhm.
Only in adolescents with endocrinal issues, they would require
Yes. Yeah.
nutritional. Okay, I think we can start the meeting now. So, good morning and welcome to Saturday Club of Baroda meeting once again. Today we have a very interesting talk, decoding women's nutrition. And for that talk, I will have to mute. For this interesting talk, we have Ms. Harak Bakshi with us, and she had been our guest speaker earlier, exactly a year back, when she had talked about diet in obesity and other issues. Today, she'll be talking about decoding women's nutrition. To introduce her briefly, she's a clinical dietitian practicing in Vadodara. She's also a diabetes educator and a certified sports nutritionist. She is founder of Let Us Eat with Harak. Pun intended, I think. Let us. And she has a vast experience in medical nutrition therapy, from working with very reputed hospitals like Kokilaben Dhirubhai Ambani Hospital at Bombay and Nanavati Hospitals and other hospitals. So with this brief introduction, I request Ms. Harak Bakshi to go ahead with her talk about women's nutrition. You have about 40-45 minutes of talk, and we'll keep 10-15 minutes for discussion. So over to you, Harak.
Sure. Thank you, Satish, sir, for this brief introduction. And I thank Saturday Club of Baroda for inviting me to speak on this very important topic. I'll share my screen now. I hope the screen is visible.
Yes, very well.
Okay. So today's our topic is decoding women's nutrition. We know that women's nutrition is very important at all stages of life. So today we'll be discussing that. We'll be checking what is balanced diet and nutrition through all stages of a woman's life. What are certain myths and facts, certain tips and tricks for weight management and keeping other diseases at bay, and certain cooking methods that we'll be looking at, which will help in maintaining a healthier life. Now we know that the lifespan of women has different stages, and every stage requires a certain amount of calories, certain amount of nutrition. And when that is not given at that stage, it reflects on the next stage. So it is very important that every stage has to be given proper nutrition. Every woman needs to understand that if proper nutrition is not taken, then it reflects on all the other diseases, especially weight management. If weight is not managed, then it leads to certain issues with cardiovascular health, reproductive health, gynec, aging and bone health, oncology, wherein you have ovarian cancer, breast cancer, certain autoimmune diseases, and brain health. So it's very important that at all stages, the required amount of calories has to be taken. Now, many a times women think that with keeping in mind the body image, they tend to take in less calories, which has to be addressed, that required calories according to their weight has to be taken. So that is something that has to be emphasized. Balanced nutrition is the key. Nutrition is essential for health and well-being at every stage of life, especially for women, because at every stage, we know that there are many ups and downs in terms of weight, and nowadays PCOS is very common and hypothyroid, and so that all reflects on weight management. Now in a day, every meal has to be balanced, wherein we take all the nutrients possible. And throughout the day, many a times women tend to skip meals. And so there are certain patients that come to me and say that I only have lunch and dinner. As I'm alone at home, I tend to have only one thing for lunch, and which reflects on their health, because the proper amount of nutrition throughout the whole day is not going. So this is something that women need to understand, that every meal has to be balanced. Only carbs or only protein is not to be taken. Balancing out the nutrition, proper meal in a plate, we have to have carbs, protein, fiber, all the nutrient in one meal has to go. So that is something that needs to be emphasized. This is a healthy eating plate. Here we can see that the plate is divided into certain portions. 1/4 of the portion has protein in it. Our protein, a vegetarian person, there are many myths that say that a vegetarian person doesn't have enough protein in their whole day's diet. But that is false. We have so many protein varieties. We have dal, we have kathol, we have dry fruits, we have milk and milk products. So there's ample amount of protein, but what needs to be emphasized here is that we have to have protein in all our meals. So our breakfast, lunch, dinner has to have some sort of protein, along with carbs are mandatory. That is a default that we have carbs at all meals, but that has to be balanced with other nutrients. So 1/4 portion of the plate here shows protein. So make sure that, for instance, our very basic breakfast is poha. So if we have poha, we need to make it healthier. So what we can do is how to add protein in that. You can add in small pieces of paneer, or we can add in sprouts in that and add in veggies. So which makes it a very healthy and palatable meal. So make sure that 1/4 portion of your meal is protein. 1/4 portion of your meal is grains. Our grains are all our millets and rice, wheat, everything. So that is always there in our plates. That need not be emphasized, but we have to have 1/4 portion of protein. We don't have to go overboard. So make sure that if you are balancing out your meals, that one day if you are having roti, make sure that you are switching it with rice and not having both the things at same time. So that is how we need to balance it out. And here half the plate shows that we need to have fiber. Now fiber comes from our vegetables and fruits. So what in our plate, what we have is sabji and salad. So make sure that many a times women say that we only have, for lunch, we have only roti sabji. Now that practice is very common and needs to be modified. So make sure that along with roti sabji, we also have dal and salad with that, because dal and salad will help in balancing out the nutrition. So make sure that the plate is balanced. Make sure that vegetables, salads that are included, soups are included along with the meal and not alone. We don't have to have only soup or only salad for lunch and dinner. Make sure that it is combined with the whole plate. Now 1/4 portion here is shown fruits. That fruits in a day many a times are skipped due to negligence or due to lack of time, but cautiously we have to make sure that we are including fruits in our day's time, and around one fruit has to be given or has to be taken throughout the whole day. Any fruit is fine, but make sure that fruit is taken and not fruit juice. If juicing is done, then we are losing all the fiber. So make sure one fruit a day is compulsory. Water intake is also very important. We know that certain vitamins require water for absorption. So water intake throughout the whole day. around 2 to 3 liters is advisable. So make sure that water intake throughout the whole day is taken along with other liquids like milk, buttermilk, lemon water, coconut water. So make sure that liquid intake is happening. Other thing is usage of healthy oils. Now oil and ghee usage throughout the whole day is recommended to up to 3 teaspoons, which comes around to 15 ml. And in a month, it is recommended that per person only 500 ml of oil should be used. So measure whatever oil you buy in and make sure that you are bringing it down to around 15 ml per day, and oil and ghee together. Now, whatever oil you use, make sure that you are changing your oil every 2 to 3 monthly. Every oil has different nutrients, so make sure that changing of oil is done, and 3 teaspoons per day. Now, same for sugar, honey, jaggery. Make sure that intake of sugar, honey, jaggery is very minimalized, and staying active is very important. Whatever exercise, however active you want to be, in whichever way, but make sure that any type of exercise is being done. Now, many a times, yes. Now, many a times this is a malnutrition table. What happens is certain girls at teenager age tend to undernourish themselves in order to maintain that body image. So when undernourishment is done, there is micronutrient deficiencies. So this has to be addressed at that root level, because if at that age undernourishment is done, then later on it reflects on other stages of a woman's lives. So we have to address that. Proper nutrition has to be taken. Many a times it also happens that overnourishment is done, and that can also lead to nutrient deficiencies because the overnourishment is done from the non-healthier part of food, wherein consumption of maida products increases, consumption of fried foods increases, wherein overburden, obesity is there, but there also happens to be micronutrient deficiency. So this has to be addressed. Balancing out meals throughout the whole day is very important. So this is something which is important. Now, body mass index, weight management has to be there. If weight management is not there, then later on, we know that there are many complications which many diseases occur because of weight. So weight management has to be there. Make sure that you are coming in the normal BMI category. And for that weight management, 4 things are very important. Make sure that your food intake, diet intake throughout the whole day is balanced. You are having all the nutrients possible, and you are having a balanced plate. That is important. Water intake is very important. So around 2 to 3 liters water we have to have. Exercise, minimum 30 minutes of exercise per day is also very important. Be it whatever walking, running, jogging, cycling, whatever exercise we want to do, make sure 30 minutes a day that is done. And also sleep cycle regulation has to be there. Make sure that 7 hours of sleep is happening, and that also every day at similar time, so that body is trained that according to the circadian rhythm, we are sleeping at this particular time. Now, along with that, we know that our lives have stress in that by default. So we have to manage stress, because stress also reflects on weight. So whatever meditation, pranayam, yoga we can do, make sure that we are doing that to make sure stress is kept at bay. And here weight management, normal BMI has to be maintained. Now, these are the 6 essential nutrients that are required in our day, which includes carbs, proteins, fats, vitamins, and minerals, and of course, along with water. So throughout the whole day, these are the key nutrients. Many a times women who come to my OPD, majority of the times say that we are alone. So we don't make so many things for ourselves. We just have one thing and we are done. Many a times we skip meals because we are alone at home, or in the tiffin, we just bring roti sabzi because we have to do so many other things. But keeping out time for yourselves is very important. Keeping your health a priority is very important. Inclusion of all these essential nutrients is very important, which needs to be emphasized. Now, these are certain nutrients that are specifically required for women, which has calcium, folic acid, iron, green leaf vegetables, vitamin C, E, etc. That we'll look forward in the PPT. Now, carbohydrates are staple diet, very helpful, and it helps in increasing energy levels. We know that carbs are by default in all our meals. If at all, only carbs are there sometimes. So that has to be modified. Of course, carbs are not bad, but we need to balance it out just so that sugar spike is not there. It gives us immense amount of fiber, so that is also required. But as we discussed, make sure that your meal plate, your lunch and dinner plate also has protein and fiber along with your carbs. So we have to have, another thing we have to understand is, make sure that maida you are avoiding, you are minimalizing intake of maida. We understand that there are so many new places of eatery being opened up, and we need to try everything. But whenever you are going out, we also need to understand that outside food has high amount of salt, sugar, oil, everything is increased. So we have to understand that whatever portion we are having at home, we don't have to have the same portion outside. Always reduce the outside portion, because there are so many oil, sugar, fat, many things are increased in outside food. And make sure that whenever you have outside food, you are reducing fried, you're not having fried or maida products. So that is one thing that needs to be regulated. And along with carbs, when we have at home, make sure that we are balancing out all our meals. Now, these are certain myths that people have, that we have, that carbs are unhealthy, it makes us put on weight. But we need to understand that in what way are we having, in how much quantity we are having it, with what food are we having it, and at what time. So all these things, carbs are not the enemy, but how we are having it puts us into a stage where it affects our health. So we need to understand that carbs. So here one thing is mentioned that don't eat carbs before exercise. Now carbs are our major source of glucose. So we need to have that for our energy. So before exercise, carb intake is must. So there are certain things that we need to understand that carbs are good for our health. But in all our meals, breakfast, lunch, dinner, all these 3 meals, quantification is very important. So what amount of carbs you are having, that is important. So make sure that portion control is there in all meals. That is important. Now, protein. We know that there are many saying that vegetarians don't get enough protein, but we do get enough protein. We have ample amount of protein sources throughout the whole day. We just need to incorporate that. Only yesterday, one patient came and said that I just have breakfast and dinner, and I go to the gym, and my gym instructor is pushing me to get a supplement, a protein supplement. And I said that no, that we have so many good amount of protein throughout the whole day, good sources of protein that you need to include in your diet rather than having that supplement dabba. So throughout the whole day, make sure that milk is added in our daily routine. Curd, buttermilk, paneer are added in our daily routine. We have to make sure that dal is included in our lunch. Many a times in tiffin food, only roti sabzi is there. But if dal is not possible in tiffin, then we need to make sure that we are changing our sabji and making it a kathol sabji. So roti, kathol, that is okay. And along with that, salad should be there. So this is how we need to modify our meals. And we know that protein is very important for muscle building and for many other things. So we need to make sure that inclusion of protein in every meal is very important. And if protein is less, many a times we have sugar cravings or cravings by end of the day in the evening time. Now that happens many a times because there is less amount of protein in our food. When protein is increased, when appropriate amount of protein is taken in our daily meals, then the cravings also subside. So inclusion of protein is important. Now, what happens if we have less protein? There's trouble losing or maintaining weight management becomes difficult because protein gives us satiety. So if we include protein in our meals, we feel full. Now, problems building muscle mass, there are mood swings, moodiness, there's poor concentration, there's there's trouble building muscle mass, there's low immunity, fatigue, low energy level, many other things. So protein is very important. And if you are a non-vegetarian, make sure that you are having lean meat. Fish is okay, eggs are okay, chicken is okay, but make sure that the quantity is minimalized. And certain cooking methods also need to be modified, that you are not having fried versions of that protein. Sauteing is fine, roasting is fine. So these are certain modifications that we need to do. So now another important nutrient is fats. There are so many patients that come to me and say that we don't have ghee, we don't have oil because I'm managing my weight. Now fat helps us with the absorption of certain vitamins. That is why also fat is needed. Many a times we have all the food and we are very good in assuming that, okay, we are having all the nutrition, but we are omitting oils and fats. But then we don't understand that certain absorption of vitamins will not happen if fat is not there. So as was discussed, oil and ghee amount has to be minimalized, has to be measured and taken. And we have to make sure that fried foods which have trans fats, that are reduced, that are minimalized in our daily routine. And we have to include oil and ghee in our daily routine. So that is how fats are important. It gives us a feeling of satiety, which also helps in weight management. So in a weight management program, inclusion of fat is also done, which is required. Now fiber, this is our favorite nutrient. This helps in weight management. It helps with gastric issues. It helps with heart issues. So fiber, we get fiber from vegetables and fruits. So we have to make sure that many a times due to negligence, fruit is omitted in our daily routine. So minimum one fruit throughout the whole day has to be taken, not with the meal, but as a snack up in between meals. So we have to make sure that one fruit throughout the whole day is taken. Inclusion of salads and soups along with meals is taken. In our breakfast, many a times what happens is that we just have roti or bhakri with our tea. So that is not a complete protein. Instead, there are other options wherein you can include vegetables in your breakfast, which will help us have more fiber throughout the whole day. So that is how we need to modify our breakfast. If you are making thepla, make it a vegetable paratha, which will help us incorporate more of vegetables throughout the whole day. So that is how inclusion of fiber has to be done. We know that vitamins and minerals are very important, and one fruit a day has to be taken throughout the whole day once anytime. And inclusion of certain fruits and different colored vegetables which are locally grown, not the foreign fruits and vegetables that are locally grown, that are of different colors, that we need to include throughout our day, which provide us with vitamin A, B complex, C, D, E, K. So these are all the vitamins that are required for our health. If we make sure that we are cautiously including fruits and certain vegetables in our daily routine, then we will also make sure that we do not get certain deficiencies. So that is how we need to include fruits and vegetables. These are certain essential minerals specially required for women's health, which includes calcium, zinc, iron, magnesium. So we have to make sure that we are including a lot of green leafy vegetables in our daily routine, certain dry fruits, certain seeds like pumpkin seeds, flax seeds, chia seeds in the very easy form such as mukhwas. So we need to make sure that for calcium, There are so many patients which come and say that we do not have milk at all. We just have chai. So inclusion of milk is important. Calcium-rich sources like curd, buttermilk, white till, chia seeds, all these things are very important for women's health. So we need to make sure all different colored fruits and vegetables are included in our routine. These are the most important nutrients. Why we need to pay extra attention to minerals and vitamins intake? Because there are so many stages in women's life, like pregnancy, lactation, being a mother during old age, during menopause. There are so many changes happening in a woman's body, wherein weight fluctuates and it gets in other disorders as well. So we need to make sure that proper amount of nutrition we are taking. B6, B12, folate, calcium, iron, these are certain very important nutrients. I cannot emphasize more on that, but this is very important. We need to include this in our daily routine. Exercising. So many women come to me and say that we are all the time doing household work, so I don't think I need to exercise. That is not true. Minimum 30 minutes of exercise is required. Any exercise in any form is required, but what is most important here is exercising before meals. Many patients say that we are going for a long walk at late night. So that is not important, that is not required. Exercising before meals is important. So there are 2 times that we can exercise during the whole day: before breakfast in the morning or before dinner in the evening. So any 30-minute exercise is okay, walking, running, jogging, but we need to make sure that along with walking, running, cardio, there is also strength training, because that is very important for females to have strength training, to have stronger muscles. So a combination of cardio and strength training should be there for minimum 30 minutes of exercise. It will help us with our stress, anxiety. It improves functional mobility, increased energy levels, and it helps in better sleep. If your sleep cycle is disturbed, then correcting food throughout the whole day and just starting simple exercises will also improve in better quality of sleep. So make sure that exercising has to be there throughout the whole day. Now there are certain foods to ease PMS, because this is a very common thing nowadays that there are many symptoms occurring during PMS. So certain foods like banana, chickpeas, beans, almonds, chamomile tea, certain foods are there. But most important here is that throughout the whole day, if a proper balanced diet is taken, then these things will gradually subside along with exercising. That is most important. So we need to make sure that balanced food throughout the whole day is being taken at all times. So another major nutrition importance occurs at pregnancy. When during pregnancy or pre-pregnancy, nutrition is very important before planning a pregnancy. If the mother is properly well nourished, then during pregnancy or during lactation, the other deficiencies, other things like raised BP or temporary sugar influction should not happen. So make sure that pregnancy nutrition is done properly. There are many times that pregnant mothers often during pregnancy tend to eat less, just because if they gain weight, then later on they won't be able to reduce it. So we need to make sure that during pregnancy, weight gain is very important, that we need to address, and proper nutrition is required. So inclusion of all different nutrients during the whole day has to be there during pregnancy. Every 2 to 3 hourly small frequent meals are required, and gradually increase in calories is required during pregnancy. Now for lactating mothers, also diet is very essential, that plenty of soups, milk, plenty of liquid has to be given to the mother. Fresh fruits are required, milk and milk products, and if the person is eating dry fruit, non-vegetarian items, then eggs, chicken, fish, that is required. Dry fruits are required. Certain vegetables and salads which are easy to digest, which do not cause gas. So those vegetables need to be incorporated, and whole grains and cereals. So maida products in every stage of life has to be reduced, has to be minimalized. We have to go for whole grains and millets. And certain galactogogues should be incorporated, like methi seeds, ajwain, soft, til seeds, etc. So these are certain things that during lactation also the mother should include in their routine daily diet. Now, post-pregnancy weight loss. This is something which is very important, and there are many myths about this, that during pregnancy, as we discussed, that many women tend not to eat more because later on they won't be able to shed those kilos. But it is important to make them understand that during pregnancy, nutrition is required, calories are required, because there's an increase in calories during pregnancy. So that nutrition has to be there. Post-pregnancy, as they are lactating, then weight loss has to happen naturally, in a natural way. So we have to make them understand that that will happen in a natural way, as far as they are having a balanced diet. So that needs to be emphasized. Now, at menopause stage, there are so many changes happening inside a woman's body that a wholesome, balanced diet throughout the whole day is important. Inclusion of complex carbohydrates in breakfast, lunch, dinner, inclusion of fruits, dry fruits as snacks in between meals is important, and inclusion of protein in all meals is important throughout the whole day, along with water intake, along with proper sleep cycle, along with exercising. All these things are very important. What foods to avoid is refined sugar and excess sodium, alcohol, caffeine, and fried foods, maida foods. That is very important throughout the whole day. That has to be maintained, that has to be managed. And when diet is managed, it helps in controlling weight, it helps in relieving other symptoms, it helps in preventing osteoporosis, it boosts mood. So there are so many things that a healthy, balanced diet brings out positively. Now, this is also one risk which happens in menopause, along with menopause, osteoporosis. So we need to make sure that we have a balanced diet which includes all the calcium-rich sources. So these are certain things, things that need to avoid. There is stress, there's excessive alcohol use. These are certain parameters which affect the health. There are certain medications, there's smoking, there's diet, there's inflammation in the body. So all these things can be managed if we have a balanced diet. So these are certain calcium-rich foods that we need to include in our whole day. Now, milk and milk products like curd, buttermilk, paneer, but that should be low fat. Sesame seeds, white til seeds, green leafy vegetables, and almonds, oranges, chia seeds, all these things throughout the whole day. Make sure that you are including each of these things, if not every day, then if every alternate day. Make sure that we are including milk 2 times, curd, buttermilk, paneer, chia seeds throughout the whole day. All these things provide us immense calcium. So that is required at that stage of life. So these things need to be included. There are certain tips and tricks that will help us manage a healthier lifestyle. So maintaining a healthy weight, maintaining a healthy BMI is required. Including loads of vegetables throughout the whole day is required. So what we discussed is that in breakfast, lunch, dinner, inclusion of vegetables along with our regular meals is required. Inclusion of foods which are rich in certain vitamins and minerals, like dry fruits, green leafy vegetables, certain seeds that we discussed, that is important, that is required to be included throughout the whole day. Consumption of omega-3 rich foods like walnuts, flax seeds, that are very good for health, has to be included throughout the whole day at any time. So these are certain tips which help us in maintaining a healthier lifestyle. Now we know that, sorry, now we know that protein is very important for building muscles. Whenever you work out, there is muscle breakdown. So immediately after working out, we need protein intake. So there are so many things that we can include. We can have milk, we can have sattu powder, we can have eggs. There are so many protein options, but we have to make sure that for stronger muscles, especially for women, protein intake should be emphasized, and protein throughout the whole day has to be taken in all meals and in between meals as well. So as a snack, you can have curd. As a snack, you can have buttermilk. As a snack, you can have sattu drink. There are so many options throughout the whole day. In breakfast, we have to include any source of protein, any kathol, milk, curd, anything. And in lunch and dinner also, we have to make sure that we are including protein. At bedtime, make sure you are having haldi milk. That is also one source of protein. So during the whole day, management of protein, inclusion of protein is very important. Now, these are certain mistakes that we need to avoid. These are certain myths that many women have, that if we eat more, then we will not lose weight, we will gain more weight. So many a times what happens is females come to me with saying that we only have lunch, very light lunch and dinner, and still we are not losing weight. And then I prescribe a diet plan, I'll give them a diet plan. They see the diet plan and they think that, oh, I have to eat so many things. Will I be able to lose weight? So that is something that has to be changed, that not eating enough calories is not going to help. Not eating enough protein, that is also very wrong. Reducing the amount of carbs, that is also not going to help. Just relying on supplements, that okay, I'll not eat this, I'll just have a supplement. So that is also something that needs to be modified. And not paying attention to meal timings, having their meal at very random hours. So that has to be in a system, that every day we are having certain food at certain time. So management of time is important. If not at the same time, 1 hour plus minus that is okay. But management of time is required, that during the whole day, if we are having something at 11, then we need to make sure that we are having that food at 11 almost every day. So management of time is important. Timing and portion size is very important. Portion control has to be there. Even if we are eating out or even if we are eating at home, portion control has to be there. These are again certain myths, that having milk in tea and coffee will help me with enough calcium intake. No, having milk all alone is required. You don't need calcium from food if you are having supplements. That is also a myth. We need to have calcium from our food. Drinking milk will lead to weight gain. There are so many foods which are targeted, like milk, like wheat, rice, which leads to weight gain, but that is not the true case. There are so many other things in our life which help in leading us to a weight gain process, but milk, of course, will not lead to weight gain. Taking over-the-counter supplements will help me. That is a very wrong practice. So we need to make sure that we are not doing these things. We are having proper amount of calcium from the food sources throughout the whole day. Now, in our Google era, all the diets are just one click away. So we need to make sure that whatever diet, whatever lifestyle I'll just say that diet is a process. So we need to follow something which is sustainable, which we can follow for a long time, and which will help us in including all the nutrients in our body. So we need to have a healthy, balanced diet, and not a temporary fad diet, which will help us, say, lose 5 kgs in a week. That is not going to be sustainable. So a healthy, balanced diet has to be promoted, has to be followed, which is, of course, prescribed from a qualified health professional and not Google. Avoid following fad diets. These are certain lifestyle and diet tips. we need to make sure that we are eating mindfully. We have to replace packaged snacks with any of our home food. So there's one time, that's 5 o'clock evening time, when most of the patients say that we are very hungry at that time. We end up eating anything that we grab. So at that time, we have to make sure that we are having roasted snack. Roasted snacks are fine, which include khakra or makhana or sing chana. So we have to have those roasted snacks at 5 p.m. because that happens many a times, even if during the morning time, if you are having lesser food or if you are skipping some meal, so that reflects on the evening time where we get more craving. So that is how we need to start our food from breakfast itself, so that we are having enough calories throughout the whole day. We have to reduce our sugar intake. Sugar, jaggery, honey, everything is same. So we need to reduce all the three, intake of all three. Vegetables, we have to add vegetables to our breakfast as we discussed. Meal preparation is important. Eating out less often. Eating at home has so many benefits. At home, we know that what ingredient we are adding in our food. We know that we are adding this much amount of salt, this much amount of sugar. Outside food, we have no idea. There's higher sugar, there's higher salt, there's higher oil. So we have to make sure that once in a while it is fine, but majority of the meals we are having at home. Be it, there are so many modifications that we can need. For example, for instance, basic pav bhaji, what you can do is you can replace the pav with bhakri. So that are few modifications that we need to do in order to have a healthier lifestyle. Alcohol and smoking should be restricted. We have to take time in eating. Thus, mindful eating should be done. And plating your own meal. When we fill our own plate, then we know that, okay, this much we are going to eat. This is what we have to eat. So plating our own meal is very important. So this is a reality check. Here we can see that there's yes or no. Are you often trying the latest diet? Do you feel guilty if you eat your favorite foods? Do you often skip breakfast? Do you spend more than 2 hours a day watching TV or using computer? If we marked yes in one or more questions, then there's a chance that we need to make healthier food choices and become more physically active. It will help us in improved health and improved weight management. So we have to eat right. We have to make sure that moderation is the key and we are eating every food in proportion. So I'll conclude with saying we are all born to be strong. Nutrition for women is very important. Having a balanced diet is very important. Thank you.
Thank you. Wonderful. As usual, no, last time also your talk was very simple and easy to understand. Today also you made it very simple and easy to understand regarding diet for women. Now we have the house open for questions, comments, discussion. I'm sure there are going to be many questions. Yes, please go ahead. Anybody who wants to ask any question, please go ahead.
In US, people take magnesium supplement. Do we have any study on requirement of magnesium level and if supplement is required of magnesium?
Yes. Hello, sir.
Yeah.
Yes.
Yes.
So, sir, during the whole, there are many. Yes, sir. Yes. So there are many foods like certain seeds and certain dry fruits that if we consume throughout the whole day, then certain supplementation is not required. Only if inclusion of certain fruits, certain seeds and dry fruits are not there in our daily routine, then supplementation is required, but generally not.
Yeah, any comments about oats and makhana and all those things? No, in our times we are not very familiar with these foods. Nowadays, all parents give oats and makhana. Any comments on this?
Correct. So it is a high fiber food, but then we have alternatives like we have dalia, we have kodri. For oats, we have in option for oats, we have dalia kodri, which is our basic Indian food. So not necessarily that oats need to be included in our daily routine. It is high fiber food, yes, of course, but we have Indian versions of that.
So they are little costly also.
Yes, yes, it is on the costlier side.
Satish bhai,
Yes.
oats has glycemic index of 57 and fiber also is less than the wheat. The only thing is that wheat has gluten. Oats do not have gluten. So, Bharat, congratulations for raising awareness for diet.
Thank you,
Because
sir.
after good physiotherapy, we need a proper scientific diet.
Correct.
I just want to highlight that all clinicians and nutritionists have to take the dietary history, because in the past, મને કડી નડે છે or all the things which irritated each patient were neglected. In brief, Indian Society of Gastroenterology has actually officially published a scientific white paper on irritable bowel syndrome and the necessity for FODMAP diet. And each symptom which if normal your dietary advice is not proper to the patient, or if he doesn't find suitable, especially women who have more incidence of constipation or diarrhea predominant irritable bowel syndrome, their diet has to be analyzed by nutritionists to find out whether there are these FODMAP this thing. There is a whole lecture on that, so I will not go into detail. Thank you for highlighting diet.
Thank you, sir.
How about popcorns and millets? Now, there's a lot of talk about millets.
Millets, yes, absolutely. We are from ages, we are including our basic jowar, ragi, bajra in our daily routine. So that has to be there. Multigrain roti concept has to be there, because every millet is different. And popcorn, one thing I'll say that popcorn is a very good snack as far as you are making it at home, not adding butter, not adding added salt. So that is one thing that needs to be taken care of. Otherwise, popcorn is good.
Some people recommend that we replace wheat with millets. How far it is scientifically valid?
So only if there is gluten sensitivity, only if the person is not able to digest wheat, then only we need to switch. Otherwise, inclusion of every millet, every millet along with wheat is required.
I was wondering about the protein content. Some of the millets have better protein content than rice and wheat. Like kodri, bajri, they are richer in protein than wheat and rice.
Correct. So that is why rotation of cereals can be done. Inclusion of different variety of cereals in our daily routine has to be done.
I think your message is a balanced diet. No, you don't advise not to take anything and
exactly include
take everything,
everything,
but in moderation.
Exactly.
The message.
Yes.
Anybody else having any question or comment? Okay. So in that case, we end the meeting. Thank you, Harak, once again for accepting our invitation. And it's always a pleasure to listen to you.
Thank you, sir. Thank you.
Thank you all. We meet next Saturday again. Thank you.